And welcome back. With summer just around the corner, you can get the beach body that you want. Joining us today is Dr. Steve Finical from Charlotte Plastic Surgery. He's going to break down several procedures that you may want to consider for bathing suit season. Hey, good to see you in here again.
Good to see you. Thanks, Brody.
And so you said this time of year, you guys are getting contacted from patients looking for what?
The phone starts ringing as soon as bathing suits hit the shelves in our office. And the usual things are going to be breast and body. As breast goes, it's usually going to be whether a reduction, a lift, or most commonly an enhancement and enlargement. In our office, we use 3D imaging. So we take a picture of a lady, and through software and computerization, we can actually do an animation of what it will look like, so there's no surprises. As far as body is concerned, tummy tucks for ladies who have had children, liposuction standard, and then the newer CoolSculpt, which is a non-invasive way to lose fat from the body.
And I imagine people probably come in with a lot of questions. Well, what are some common questions?
Certainly. Well, the most common thing really is safety for people. People want to have a safe procedure. We certainly want to have the most safe thing that we can do for someone. So in these areas, breast and body, the only board certification is the American Board of Plastic Surgery. There's no other substitute. So you want to look for that in your surgeon.
Yeah, and also, you know, I'm sure a lot of people wonder what's right for them. I mean, if people come in with something in mind they want done, how do you help them kind of pick the right procedure for them?
Well, typically you'd want to go to someone who has all the options available. You know, if you have a hammer, everything looks like a nail.
Right,
so
exactly,
really you want to see somebody who can offer you liposuction, could offer you CoolSculpt, could offer you breast enhancement, all of those kind of things, and not just one size fits all kind of thing. So it gets customized to the person.
You know, a lot of people, I'm sure, feel apprehensive about putting on a bathing suit, you know, especially women who age, they've had children, and maybe they're feeling nervous about the bathing suit season. Do you talk to them after they get their confidence? I mean, how does it kind of help them, you know?
I'll tell you, it really, really helps. The thing, ladies that have had children in particular, and their tummies never come back, they feel like if I can do just a couple more sit-ups, I could get it back. It really doesn't work that way. The stretch that's put on the muscular wall of the abdomen never comes back. So really, when we do a tummy tuck, we're doing an internal corset and tightening up and putting those muscles back where they belong. No amount of exercise would have done that. There's a lot of guilt in young mothers having surgery, and certainly they shouldn't be deterred by that kind of a thing. There really is nothing that they could do that would make up for what nature has done to them with childbirth.
Yeah, it's an interesting talking point. You said a lot of women do feel guilt or feel kind of a but talk to me about that. You know, what do you say to young women who feel that way?
The concern really is I'm doing something for myself, and should I feel guilty about doing something for myself? I've got young kids at home. I'm worried about them. The truth of it is, probably for most ladies, driving in their car to get to my office is a more dangerous endeavor than going to sleep for an elective surgery, because we can control so many variables. I'm not talking about their driving habits, but the problem with it is really when we can control variables, nothing to eat or drink after midnight the night before surgery, those kind of things that raise the safety spectrum, then what we're doing is really safe and acceptable.
Well, it's tough. There's so many, you know, pressures on when you see women on TV nowadays, you see models, you know, there's a lot of pressure on women who feel like they want to maybe, you know, look like that or look like how they used to look. What about mothers who are thinking about still having children? I mean, do you recommend, you know, putting off certain surgeries until you're done having a family?
Absolutely, and that's really part of the consultation, part of the discussion. If somebody's trying to have another child within the next year or so, you know, certainly put that off. But if people are satisfied with family size, that's usually a time that people start to pursue, I want to get this fixed.
You know, real quick also, obviously beach season is right around the corner here, so you want to keep in mind if you have a vacation coming up, how far do you have to plan ahead for this sort of thing? You know, I guess it depends on the procedure, but typically what's recovery time like for a tummy tuck?
Depends on the procedure itself, but I would tell most people to stay out of their social circles for a week to 2 weeks, and then not back to exercise or, you know, an important event, family wedding, class reunion, or a vacation for about a month for recovery for most things.
Yeah. Well, some great advice there. I know you guys have been in the Charlotte area, you said, for more than 6 decades. So
correct. You know, 64 years this year.
64 years. Trusted practice. Thanks so much for coming in. Also want to mention there's a Body Beach seminar at Charlotte Plastic Surgery. That's April 16th from 6 to 8. It is RSVP only, the event, and people need to call, reserve their spots. So keep that in mind if you want to get more information. Sounds like they can take care of you. So keep that in mind. Of course, we'll get info up on our website as well.